Okay, we're gonna get started now. It's 7 o'clock Mountain Time. So we're gonna go to the first slide and just give you the next slide. So welcome to this, it's not a webinar, we're gonna have a dialogue. This is about empowering people to make a difference. Next slide, please. I'm not going to read this. This was distributed to all of you in the agenda. This was started in 2018. This is a definition. This is not the definition. This is a definition that came out of the 2018 first Global Engineering Peace Conference. That was in November of 2018. The takeaway is that we need to change the mindset of all existing disciplines, not only engineering, every existing discipline, and we're going to have to create new ones to address global challenges. Next. The topic of our conversation is health, well-being, eco, and peace engineering. The world has changed. Health is driving the world, and we need to provide all the necessary infrastructure to do good healthcare. Next. There's somebody, there's background. If you're not gonna talk, can you please mute yourself? Thank you, thank you. Next slide. So this is the agenda. We just made a change. So we're going to take a few minutes. So, want to go back, please? Yeah, so Bruce will talk right after I introduce it, the whole theme, and then we'll proceed with Bernard and Bill Oakes. Next. Let me give you some context. I am in the state of New Mexico. And for me personally, what we're trying to do is to enable and empower people, communities, and institutions to deal with global challenges, okay? New Mexico is very diverse. We have 24 different ethnic groups. We have 2 basic languages, Spanish and English. This is where we have one of the highest concentrations of scientists in the world because of the national labs. Every technology has been tinkered here in New Mexico, and most of that technology has gone elsewhere, has not really benefited the economic development of the state. We are a poor state. We are ranked number 49 out of 50 states. So we need to change also how things in New Mexico. So we need to respect the cultures that we have. We need to preserve the cultures. Something that is very important for us is people need to have access to information and knowledge. It has to be symmetric if we want a level playing field. If we have that, we will have also justice. I'm borrowing the phrase from Echo, to make a difference today, we need to all teach, all learn. We need to solve problems that are needed solutions today. This is the purpose of this alliance of peace engineering with ECHO, so we can address healthcare, well-being, and provide the necessary infrastructure and empower people to make a difference locally. This is not one recipe fits all. That is a nutshell what we're trying to do here for my state. This is how I see. And also this can be replicated, I believe, globally. We all need the same tools. Next, please. So now I'm going to ask Dr. Bruce Struminger to talk us about the ECHO model.
Great, thank you, Ramiro, and wonderful to see everyone this morning. I'm Dr. Bruce Struminger. I'm a general internist and professor of medicine at the University of New Mexico, and I'm a senior associate director at Project ECHO. which is based at the University of New Mexico. And it's really a pleasure to join you all today. Before joining the University of New Mexico about 7 years ago, I worked with the US CDC as the country director in the Ivory Coast. I spent 3 years there, and then in Vietnam. When I came to Project ECHO in 2014, it really was to help bring this model of collaborative problem solving, workforce development, and telementoring to Africa in particular, where the model had not yet been introduced. So I'm going to give a quick overview of Project ECHO, primarily from the health perspective, just because that's where I work. But I am thrilled to see that this group is going to be adapting the model to apply it to the engineering context, which I think should work extremely well. So the title of my talk is Promoting Health Equity Through Implementation of ECHO Virtual Communities of Practice to Build Global Health Workforce Capacity. You could easily change this to Promoting Engineering Equity through Implementation of ECHO Virtual Communities of Practice to Build Global Engineering Workforce Capacity. Hopefully that's where you'll be going with this. To me, what's really important in this title is the equity piece, for one, that ECHO is about distributing knowledge and experience where it's needed, when it's needed, and not keeping it locked up in ivory towers, academic centers, often in capitals of countries, but not flowing to districts and regions throughout those countries. With this, using video conferencing the way we are right now, we're able to connect across the world and collaborate together wherever we are. Also, it is about building virtual communities of practice. These are not webinars, these are not one-off events. These are communities of learners and collaborators, many of which have gone on for many years. And I'll give a few examples of that. This is just a screenshot of the first ECHO program in Africa. It started 5 years ago. The anniversary will be this November. So this is in Namibia. It was an HIV ECHO, and it was a collaboration with the Ministry of Health in Namibia and a number of other partners, but it is owned and operated by the Ministry of Health in Namibia. And it has grown from a community that started with 10 large hospitals to a community that engages over 50 large hospitals, every large hospital actually and district hospital in Namibia. And it has been running every week for the last nearly 5 years. This is a slide from Kenya of a multi-drug resistant TB ECHO that started 4 years ago. And what's notable about this is everyone in this picture is connected on a mobile device across the 3 or 4G network in Kenya. Very flexible. So our mission is to democratize knowledge and dramatically improve access to best practice care or best practices to improve the lives of underserved people all around the world. And we do that by partnering with other organizations like the Peace Engineering Organization. Just want to go over, this is probably the most important slide. It's the model. The ECHO learning model is a bundle of 4 practices. The first is to leverage this technology, video conferencing, to bridge geography and connect people across the world so that we can amplify scarce human resources, both scarce resources of expertise and scarce resources in the field. And it's very much, from my point of view, in my vision of development, that it's about empowering the agency of local experts and practitioners. Certainly you can engage global experts, and that's a wonderful thing to do, but ideally these programs are building local communities of practice, leveraging local expertise and bringing in regional and global expertise as needed. Most importantly, this is a case-based learning model where the participants present real life cases For health, it may be a patient case, it may be an operational or system case. In engineering, it probably will be a variety of individual practice cases of implementing engineering practices and system issues as well. And then through a dialogue and discussion and peer-to-peer input as well as expert input, there's a mentoring process that goes on to help the individuals who present those cases. But it's as Ramiro said, it's an all teach, all learn model where everyone who joins the community learns from hearing about these cases and discussing them. The third element is sharing best practices. This is often done by having brief 10 to 15-minute didactic sessions, usually given by a subject matter expert, to reinforce evidence-based knowledge. And then the fourth element is monitoring and evaluation. So having some element of monitoring and evaluation of your program. We do it by giving continuing medical education credits in return for people completing a brief 10-question survey at the end of every session so that we're getting feedback and can implement continuous quality improvement for our ECHO programs that we implement. And we encourage that of our partners. So just to differentiate ECHO from webinars, because people often ask this question, how is this different from a webinar? Most webinars are one-off events that are focused on disseminating information. The majority of the time in webinars is usually speaking or presentation and minimal dialogue. And it's usually primarily unidirectional, expert pushing out information. Very useful in many contexts, but not the approach ECHO is taking, which is more this approach, where knowledge and experience and information are flowing in all directions between experts and novices, or between the central hub team and the participants wherever they are. But we hear over and over again that people actually value the peer-to-peer learning more than anything, or value that the most. This is just a slide that summarizes a number of adult learning principles that we try to promote and implement: experiential learning, problem-centered learning, case-based learning, interactive engagement through polling, through discussion, et cetera. For us, and this is using a healthcare example, I see it as a great opportunity to bridge fractured health systems by linking government ministries with academic medical centers. But I think you could just put engineering in each of these buckets and connecting public sector, private sector, academia, the government. We need everyone communicating and working together. And also, this is using healthcare examples, but whoever would be part of an engineering team should be invited to be part of the learning community. So all the different pieces of the puzzle. This slide just summarizes why we think ECHO works. We have good evidence for some of this, and some of it we still need to gather the evidence. But certainly in my experience, the more you can start when you're creating your community to listen to the participants and co-create your community of practice so that it's a need-based learning experience addressing current needs of your learning community. Case-based learning, experiential learning, it's a collaborative learning approach. It is a low-dose, high-frequency learning. Most of these programs will meet weekly or twice a month for an hour, maybe 2 hours at most. There's good evidence for low-dose, high-frequency learning being much more effective than high-dose, low-frequency learning, like sitting for 2 or 3 days in a hotel conference room for 8 hours a day listening to lectures. That usually doesn't work so well. Interprofessional learning, peer-to-peer learning, the mentorship both of experts and peers. We really try to promote a non-hierarchical approach. I think of these in many respects as like graduate seminars. The social professional learning component, super important. And it is a quality improvement is implicit in the approach, But more and more, we're seeing explicit quality improvement with PDSA cycles being introduced to many programs. Just want to highlight that in the US, we have partners in almost all 50 states, in 48 states across the US. There are over 250 partners now implementing nearly 600 programs. Globally, actually now there are over 40 countries, about 42, implementing almost 1,000 programs, and it's nearly 400 partners that are doing this. This is just that first Namibia project. They did a very good evaluation that actually was just published a week ago, and the study and evaluation in Human Resources for Health, and happy to share that article, which gives good evidence for the effectiveness of the model in Africa. Since then, there have been many adaptations of ECHO across Africa. There are actually over almost 50 programs being implemented in over 15 countries in Africa in subnational level programs, but there are also a number of multi-country programs. The Infection Control Africa Network, based out of Stellenbosch, runs an infection control ECHO that engages participants in over 10 countries. The African Society of Laboratory Medicine has been running for almost 3 years, an 11-country molecular diagnostic laboratory quality improvement ECHO. And about 4 months ago, they added a COVID-19 laboratory ECHO on top of the HIV viral load ECHO. The Africa CDC at the African Union has been a partner for over 3 years, and they support 4 regional international health regulation implementation ECHOs that engage very senior Ministry of Health colleagues in these 4 regions, all the regions but the northern region, which hopefully this year will get added. This is their emergency operations center at the African Union, and they're connecting with colleagues across Southern Africa here to talk about things like the Ebola outbreak or COVID-19. They use, as a complement to their live ECHO sessions, Slack as a way to communicate. They also use WhatsApp. So having some kind of asynchronous communication for your community can be very helpful. I just want to, I've got a couple slides left, highlight some of the ways partners have leveraged ECHO to address COVID-19 in Africa. This is a USAID supported One Health program that engages medical faculty, veterinary faculty in multiple countries across Africa to address COVID-19 in the context of One Health. We've been working with the World Health Organization since about April to support them to do a number of programs that are engaging nearly all 47 countries in the WHO Afro region. This was one program that engaged over 1,000 participants in 58 countries. This is a map showing where those participants were located. So the ability to engage colleagues across Africa has worked very well. This is another CDC WHO collaboration that was engaging a series of 12 sessions on infection control, engaged over 1,000 participants in 122 countries. This is another CDC program focused on advanced HIV disease that, again, engaged almost 500 people in 46 countries. And with that, just our motto is moving knowledge instead of patients and healthcare workers, but you could easily adapt that to moving knowledge instead of engineers. And with that, I'll end. And I don't know if we have time for 1 or 2 questions, Ramiro, or if you want to just.
No, thank you, Bruce. Since you have to leave, we can probably take a few questions and then we can start. Questions, please, for Dr. Bruce Struminger before he leaves.
Hi, excuse me, this is Aqua from Sudan.
Yes.
Yeah, can you please just tell the audience how to join the ECO program?
Well, how to become a partner and to start your own program, is that what you're asking?
Yeah, yes, yes.
Okay, great. And my colleague, Clark Wigley, who is on with me, he will be remaining throughout the session today and can also probably help by following up in the chat, et cetera, on details related to that. But basically, if you just write us an email, and Clark maybe can share who to write, we can reach out to you. It's a very simple process. We have some partnership documents. There's no financial engagement. It's free to be an ECHO partner. But we have some partnership documents that just outline things like intellectual property and how that's handled, what we're going to give you and share with you, which includes Zoom licenses at no cost and a number of other access to an online library of a lot of helpful information. We then run every month a virtual 3-day training. So you will be invited to join one of those virtual 3-day trainings, which you can do from Sudan. And you take that training and then you design your program and implement it.
Okay, thank you so much.
You're very welcome.
Yeah, can I just raise a question? This is Obiazi from African Engineering Dance Council.
Yes, please.
Okay, from the maps you were showing, it appears that you are more concentrated in Central and Southern Africa. The Northern Africa and West.
I think we lost the audio, but what I was hearing is it seems like the participation is heavier in Central and Southern Africa and less in West and North Africa. And that's
Yes,
true. ECHO has grown in Africa organically, and it really has been growth that has been generated by partners who heard about the idea and wanted to implement it. So just the way things have worked out so far, we have fewer connections in North Africa. So we just haven't seen the growth there, not because it won't work there, I think it will, but we just have not had the relationships there. And as I said, Africa CDC is still working on their North Africa regional collaboration. We actually are about to start a West Africa global health security program that is funded by the US CDC. So you will see a much more engagement in West Africa. Senegal is starting a program, and Gambia is probably going to be starting a program soon, in Liberia. So I think we are going to, in the next year, see more activity in West Africa.
Thank you.
So,
we'd love to see.
Thank you very much. I'm
Yeah.
Professor Hassan Ahmed from Sudan.
Yes.
And we are really very glad to participate in this project, because you see, Sudan is a large country, and there is a lot of inequity in the distribution of health services. At the same time, the university is adopting really many community-oriented or community-based programs. And the ECHO program will really be of great help in transferring our services and experience to our remote areas. We used to have, I don't know whether it will be given much time, because we have got the experience of participating in the eradication of sleep sickness of onchocerciasis in Southern Sudan. And we also, the university participated in the project of trachoma in the Northern Sudan. And a few years ago, we introduced what is called the Scout Health Project, where we introduce actually child and maternal health to villages through our students and staff members. And we have got also a program of rural rural residency, development, and research. All these are really community directed or community-based programs. And when I went through quickly the ECHO, I found that this is really a unique chance to transfer this knowledge to people.
Thank you for that statement. Thank you, Bruce. But I'm going to have to cut it
Yeah,
here because
I know.
we're way behind.
Keep going. I'll just, Professor Ahmed, I put my email in the chat. South Sudan has an ECHO program. And happy to share information about that. It focuses on HIV, and it's already there, so you can build on that. Thank you all very much for inviting me, and I hope you have a wonderful virtual conference.
Thank you, Bruce. Okay, Donna, can you put the slides back? Thank you, everybody. There's great interest in this model. Now let's move everything now to what we want to do, which is related to peace engineering. For healthcare to be implemented and delivered to the remote sites, we need the engineering infrastructure. And this is, I think, what we can contribute to the world, bringing all the engineers to work together to solve specific problems. One of the key areas we think is water. The other one is energy and bandwidth telecommunications. So I'm going to stop here and invite my colleague, Bernard Amadei.
Yes, good morning, good evening, good afternoon, everyone, and thank you so much for allowing me to say a few words about engineering and ECHO. And thank you, Bruce, for your excellent presentation and summarizing the ECHO program. What I want to say is there's a very strong value proposition of integrating engineering into the ECHO program. I'm talking about integrating because when it comes to making the world a better place, I think our great vision is how can all people on this planet have the resources and the skills to live in a peaceful, healthy, and prosperous manner. And in making that statement, I'm not talking about health, I'm not talking about engineering, I'm looking at an integrated approach. And I think the ECHO program allows us to develop, essentially to empower the engineering profession and have this engineering profession work in partnership with our colleagues in health. After all, my experience when it comes to working in developing communities around the world, it's about health. Engineering is just a subset of health. As Ramiro mentioned, we made an attempt at the first ECHO session a week or so ago with a refugee camp along the border between Mexico and the United States. That was our first attempt, and we are planning to essentially grow this peace engineering ECHO sessions over the weeks to come. As Ramiro mentioned, one area is the issue of water, right? I mean, we're talking about COVID-19, we are telling people to wash their hands, but they're going to tell you, hey, we don't have water. We don't have clean water. So of course, here's a good example of how engineering is connected to health. Same thing about energy. When you want to fight COVID-19, you need equipment, and that essentially requires energy. One of the ECHO sessions that we want to have in the weeks to come is how to power health clinics. Again, that's the link between energy and health. So I think the ECHO program represents a very unique platform for all of us around the world and our colleagues here from Africa to connect. And it's not a webinar. Imagine how much information we all have, how much knowledge we all have, the skills that we all have that have not been shared across, essentially across borders. So I think ECHO program, if we have a weekly ECHO program, we can cover a lot, really a lot of material. We can create a real community of practice around the world that cuts across different disciplines. And it's about bridge building. across disciplines. So I just want to say a few words of support of the ECHO program, how to integrate engineering into the ECHO program. This is a fantastic program. Someone mentioned my level of sound, it was low. This is a fantastic program, and I think we should endorse it. Thank you.
Thank you, Bernard. Next, I'm going to invite colleague William Oakes from Purdue. Bill, are you connected?
Yeah, I thank you, and I want to echo what Bernard said. One of the pieces that I want to bring it is what we envision is we have tremendous resources in our universities, in our engineering program. And part of this ECHO model and this partnership can be bringing technical expertise to engineers, but we've also got the opportunity where we can bring some of that technical expertise and mentoring to our universities. We have a program at Purdue, and we've got a network of universities globally that have integrated projects that address needs within the community, locally or globally, into the curriculum. We've put in project-based courses. We've looked at ways to engage students in real projects and have their learning documented. We view the partnership with ECHO as a way to provide resources for students as they address these needs, and also resources for faculty. Many faculty at the institutions in our country don't have experience with projects out in the field or in the developing world, and many of the other countries that we've worked in have had a similar thing. So linking expertise for our faculty and our students to address technical things, and also to create ECHO nodes and support systems for faculty as they look at changing their curriculum, changing the way the courses are structured to allow more of these projects into the curriculum. And I will close by adding our focus is on how we can have an impact on our community, but there's also research out there that engaging students in these projects with proper mentoring and scaffolding can help them become leaders out in traditional industries in our societies. And that's the piece that I look to bring. Thank you.
Thank you, Bill. Next, I'm going to invite Mike Paddock and then Rodney Herrington. They're going to address the issue of water. Mike?
Thank you, and good day to everyone. One of the areas that I'm personally very passionate about is water and healthcare. Water is really a cross-cutting technology that needs to be addressed through all of the healthcare system. So, water is one of the most important tools that any healthcare facility can have. And as the World Health Organization says, a healthcare facility without water is not a healthcare facility at all. There's 2 billion people on the planet that lack access to safe water and sanitation at a healthcare facility. And I think this is one challenge that all of us recognize needs to be addressed. The pandemic has really focused this inequity, and from 2 reasons. One, we have more patients than ever before, but also each patient demands more water than a typical patient previously. So this is one area that we would like to focus on. We believe that it's a timely and relevant issue to address across engineering and health systems. And I'll turn it over to my colleague Rodney Herrington to talk a bit more on this topic. Rodney.
Thank you, Mike.
Can you hear me? Can you see me?
Yes, yes, Rodney, we can see.
Okay, I'm
Hear you.
I'm CEO of Aqua Research, and we develop technologies. We do a lot of work with University of New Mexico students to help us with the development of the electrical components of these technologies. So we make technologies that are appropriate for disinfection and sanitation of water and healthcare facilities. So we have a variety of products that we have developed and are being used worldwide. The H2Go Global's little handheld 4-ounce device, 100 grams, that only uses salt as a feedstock to convert that salt to chlorine. So a family, for instance, can make 40 liters of water a day with this device at a price of 50 cents a year in salt, and it'll do that for 10 years every day. We're doing a smaller device that's even more economical. This device is retails in the US for $100, and it's we sell to a non-government organization, humanitarian purposes, of $50. We've also developed this briefcase type unit for stream, which is being used in a number of countries, particularly in Africa, in Tamale Teaching Hospital in Ghana, Madagascar, Burkina Faso, Rwanda, Uganda, Zambia, Kenya, places like that, and a number of them in Haiti under USAID programs. And we work with PATH, P-A-T-H, out of Seattle to introduce these technologies. We have a smaller spraying system which makes volumes of chlorine. It's at 0.5%, it's 5,000 milligrams per liter, which is the dose recommended for contaminated areas in healthcare facilities. We also have a 20-liter container with an ultra filter, and the ultra filter is small enough to remove virus, bacteria, and everything from the water. And then we have commercial systems. A number of these are going to Haiti under a USAID program to provide a lot of volume of disinfection for 168 healthcare facilities in Haiti. So anyway, we work with a number of organizations to implement and get this technology out there. It's very economical to use, and you know, we look forward to working with you.
Thank you, Rodney.
Back to you, Ramiro.
Thank you. Next slide, please. Now we're going to switch to my colleague, Richard Harrison from Canada. He's going to bring topics about funding. Richard?
Hey, everybody. Can we go to the next slide if I think it's there? Thank you. It's really important that when projects like we're talking about here from the engineering and from the humanitarian and health side, it's really important that funding is available. I've been fortunate over the last little while to connect with a group that has $100 billion funding for this year and up to $200 billion for next year. It's a humanitarian funding, and you'll see it says no debt, no recourse, non-recourse. It's a funding program that if you have a project that is focused around humanitarian, environmental, and social impact, these guys will consider it. And they're very good funding. The process doesn't take a long time. It's got a minimum of up to $150 million, and it goes into the billions. The key on this whole thing is that it needs to have federal or state government support. And what I mean by that is they have to be behind the project. This group will not allow any under-the-table funding, any incentives given to people. It's a strict program, and it's managed by international accounting firms, but they do need the federal government. As I say, it's non-debt, and it starts from the very beginning. Could be the engineering process, it could be the gathering of data, the land preparation, all the way up. So if you're doing a housing project, it could be from the engineering drawings all the way.
Hello, Richard. Hello, yes. Richard. Your mic is in and out. Are you able to speak directly into the computer?
Yes, thank you.
Is this better for everybody?
Yes,
yes, we can hear you.
Better.
Okay.
Now we can hear you.
Thank you very much. I wasn't sure if my headphones were working. Okay.
No, we can hear him. We can hear him.
Pardon me?
Go ahead, Richard, continue.
Okay.
Now we can hear you better.
Okay, thank you. So it's a funding program, and you can get a copy of this slide. And this slide really just says it. But at the end of the project, 60% of that project is gifted back to the country and the developer, and that's free of charge. So think of it as a 60% gift. So if you've got a $150 million project, you're getting a massive return. 40% is retained by the investors, and it can be purchased by the government or the developer for cost, no interest, but for cost. And the timing is once the paperwork is done, it takes usually a couple of weeks to do the paperwork, but once it's done, the first draw for the project can happen as quickly as 6 to 8 weeks. So again, it's a humanitarian funding. The idea behind this is to help countries like Africa take on financing that's non-debt that will help them develop projects right across the country. Any questions?
Thank you, Richard. We're gonna continue, and we have a Q&A session after we finish. Thank you.
Thank you, guys.
Next, I'm gonna invite Jason Lee, founder and CEO of Smartcone.
Hi, how's everybody today? Thank you for having me here. I really appreciate it. My name is Jason Lee from Canada. I've traveled the world installing infrastructure products like this before that you see in front of you on the slide. And I have to say that being Canadian, we focus on cultural preservation, but personally, for me, I like the humanitarian approach, and I want to say congratulations to everybody who's in this project to help make it something that we can provide these kinds of technologies and to people around the world. So part of my life, I spent the last 20 years traveling everywhere to multiple places in Africa, South America, Asia, and many places. And most of the places I go to are very underserved with infrastructure. But what I found in every place is that the people are innovative. The people have a lot to offer. They're ambitious. They want to do lots of things, but they don't have access to infrastructure to make it happen. And that's the biggest thing that we face. And so if the people that in these countries had access, then they could demonstrate and show how they could, make a difference in the world. And so we want to enable that to happen by providing a level playing field. And I understand that most of the conversations we're having so far are about health and helping and giving back, which are all humanitarian and wonderful. And I appreciate, but my part of it is the business. If you don't have a sustainability plan, if you don't have an infrastructure plan, it makes it really difficult to do all of those things. And so together with this team, you've heard from Rick on the funding side, together with this team, providing you with community-based access to technology is the goal here. This is the sustainability. This is how you actually get to incorporate yourself with all these different plans and technology and revenue. And that brings me to the last point, which is the community approach. By providing these components on a community level, it generates revenue for your community. It helps pay taxes to the government so that the government, when they get their piece of the system, which you have to do, right? Nobody's going to set this up and then, the government's going to come take their piece of the pie and you're left with nothing again. We don't want to do that. Instead, we want to have a community focus, which is the great thing about this strategy that we're putting forward to you now. We're building the first one in New Mexico. But Smartcone itself, which is my company, has relationships with other global 5G companies.
We can't hear you, Jason.
Yeah, there's somebody had a phone ringing there.
Oh, okay.
So anyways,
sorry.
That's okay. So having relationships with the North America's largest nuclear power company, with two of the world's biggest site 5G companies, some of the biggest internet companies, IBM, Accenture, all the big technology players are Smartcone's partners. And we're bringing that all to you so that we can have a community-based ecosystem along with the funding so that you can provide all these wonderful gifts that you want to give the world, and it's sustainable. That's our goal.
Thank you, Jason. Next slide, please. So these are the 3 areas that we have identified that would like to start. We're not limiting to these areas, but I think they're all connected and they're needed. We want to generate these community of practice where everybody teaches, everybody learns, and we empower the communities to make a difference globally. Next slide, please. So if you want to get involved, you have my email. You can send me an email at UNM if you want to learn more about Project ECHO. All the information of ECHO you can find in the IFEES homepage. If you want to learn very specifically about the COVID-19 response, that is the web link. If you access the ECHO webpage, you find all the different areas in healthcare that they are dealing with globally. And next slide, please, Donna. And now I want to open up for Q&A. We have about less than 15 minutes, and we would like to have a dialogue and see how can we help. This is what we like to do using the hat of IFEES and GDC, empower all our engineers, all the different organizations that form IFEES to make a difference, work together so we can deal with these global challenges. We are reaching a point of no return with climate change. We really need to act now. Thank you. Now we're open for Q&A. Thank you, everybody, for participating. Questions, comments?
So it's time for questions. Can we bring up our questions, please?
Yes, questions, please.
Okay. Christian?
Yes, Christian.
Yeah. I think, first of all, we need to thank GEDC and IFEES for supporting this program, particularly for Africa. It gives us a hope that, yes, when we want to do something, we've got friends across the world that can work on our problems. Now, one of the fundamental things about sustainability is the ability for people to innovate or to look at the problems they have and think through how to solve it. And it would be nice if it will be possible for us, maybe as we engage later, to see how the African people, particularly African engineers, are thinking about their problems. And their pattern of thoughts a little bit different. They start with the most important, the most basic things, and then build up to the most sophisticated. I think it's a very good meeting, and it's given us a clear picture that we can engage with more people. There are, particularly in Nigeria, we close to graduate about 13,000 engineering graduates every year. At any point in time, there are about 80,000 engineering students. And we have a very active deans of engineering that identify issues, problems, and they would like to solve it from their own perspective. Of course, collaborating with people outside. So this is a very good, it's a very good platform. I think as we engage ourselves, we will then come up with some more things. There are some issues we're handling today. You can see, if you notice in I've been checking that the number of drops, people who have been dropping and coming back to this seminar have largely been from Africa. I've been taking note, I can give you the count now. And it shows there is a communication problem to engage on just a simple Zoom meeting. It's a very serious one. And when you want to then talk amongst Africans, it's even worse. It's even better because we are communicating to UK, US, Amongst Africa, so communication is a big problem. And I think we're going to engage the team on communications. Water, of course, is also a problem. So it's a good, in summary, this is a good platform. We'd like to encourage it, but think from the African perspective. Thank you.
Christian, this is Jason Lee speaking, and I want to congratulate you for summarizing African needs and specifically Nigeria. I spent, personally, I spent a great deal of time in Nigeria. I don't know if you're familiar with the Aqua Hospital and Education Center in Kogi State, but Don Campion,
Judge. Yeah.
And Don Camp's a friend of mine, so I helped there as well, and I pounded my share of yam. But so when I was in Africa, in Nigeria, quite a few different accounts, I spent time with technologists and the National Assembly and so on. And I have to agree that with you that the potential for the talent in Africa and Nigeria is immense. And it's only the infrastructure and the capability for the global stage that gives that. The unfortunate part is Yahoo boys are really good at you know, the coding and this and that, and that's what the world knows. But I have to tell you, to be as good as they are is pretty amazing. So through this program, setting up a global data center and setting up a technology center and manufacturing and distribution for technology throughout all of Africa is here within the dream and reach of Nigeria. And from my own perspective, and it's limited, but it's my own perspective, that the heart and contribution of Nigeria is truly benefiting the view of Africa. And that's something I personally like to be involved in. And, but I just wanted to echo that for sure, this is a platform to enable what it is that Nigerians and Africans can now get and be on the global stage and equal, technologically speaking, with other nations.
Thank you, Christian. Thank you, Christian. Thank you, Jason. Any other comment, question from the audience?
Please, can we make comments? Can we send in our questions?
Please, we have about 7 minutes.
Yeah, Godwin.
Yes, we
Godwin.
have
Godwin here. Can you hear me?
Yes, we are hearing you. Go ahead.
Okay. My own concern is on the humanitarian funding aspect. If we have not thought about it, we need to start thinking about it. The challenge of overcoming the challenge of non-responsive government, where people may have initiatives, but the moment the governments are involved, then it's just a killjoy for them. Just a short, quick comment.
Yes,
my comment actually from Sudan. I'm really got fascinated. Each time you present something, I remember the Sudan. Now we are having, as you know, devastating floods, and the most important is the waterborne diseases, which we have got a lot of waterborne diseases, like malaria, for example, killing thousands each year. Number 2 is the diarrheal diseases. Number 3, the inability to mobilize medical services to the periphery, so that the experts in universities can help their community. I really found it really fascinating, encouraging, and I do believe that in our situation, ECHO can be very helpful to solve many aspects of life in our country. So thank you very much for this collaboration with you and giving us a chance to be exposed to this fascinating program.
Thank you. Thank you. Please, if you have questions, you can always write them in chat. We will look at all those questions and get back in touch with you. Any other question? We have a few minutes.
Ramiro, can I just talk about the non-responsive government comment?
Yes, go ahead, please. That's
okay. That is a real problem. In a lot of places, non-responsive government poses the biggest obstacle to expansion of infrastructure. And we've been part of programs before where we've been able to create support with the governments so that it does move forward. And that's a very important part of moving this forward. Everybody in the world knows humanitarian help is useful, but the sustainability and forward movement and engagement with local governments is always the tricky part. And so in the architecture of, can you go back up to the slide, Ramiro, of the architecture? Is that possible?
yes.
The part when we deliver something like this, okay, this model is not just about enablement, but it's also about revenue generation. It also has to make money. It has to be able to sustain itself. It also has to be able to pay the governments. It has to be business itself. And each small business is clustered in the community. Not a big business that you control and take, but a smaller community-based business that puts more control in the local governments is the key to making sure that this rolls forward without too much disruption, but gets the engagement of the people, the money, sustainability, enablement. This is the plan. And we've done this plan in the past and it works very well. In Nigeria.
Thank you, Jason. Any other question? We're running out of time.
Ramiro, this is Hans.
Yes.
Can you hear me?
Yes, Hans.
I'd like to ask the chair of the African GDC Deans community, Obiazi. He is a key factor and leader together with Christian and several others. I'd like to hear your thoughts for a couple of minutes of what you've heard in terms of the next steps moving forward. Thank you.
Okay, thank you, Hans. I thought I would speak last, and thank you for calling me in. We have listened to very important different aspects on water, on energy, on telecommunications, and how to harness our energies, both from engineering and from the medical perspective, to solve human problems. So like Christian said, this is a big step moving forward. And we in Africa, of course, the world knows that we have these challenges. And like somebody spoke just now, that we have, across many of the countries in Africa, we have unresponsive governments, non-responsive governments. So I think we also need to begin to think outside the box. How do we go ahead to do what we want to do, even in the face of governments that are not responsive? Can we work with the universities? Can we work with the engineering organizations? Can we work with the medical organizations? Because our governments have problems. So I think moving forward, we need to begin to package collaborative proposals. They've given us links with which to work with. So we'll have follow-up meetings to discuss how do we engage with ECHO, how do we engage with the different organizations that have been brought forward to us, so that we can move this process forward. I have been looking at participants throughout this meeting, and the thing has been going from 70 to 80 to 90, it drops, and that's because people are having issues with communication. So we need to deal with that. Water is a challenge. Energy is particularly a challenge in Africa. Apart from 1 or 2 countries in Africa, the rest hardly have 24/7 power supply. So that's an issue that we can also address. But overall, I want to appreciate Dr. Ramiro for this wonderful presentation, for assembling the team that he has packaged to make this presentation. So I want to appreciate my Paddock, William Oaks. I want to appreciate Rodney Herrington, Richard Harris, and Bernard Amadei. In fact, William Oaks, if Hans Hans, I don't know if you can remember in 2013, when we went to University of Purdue, you know, I think we met with him. So seeing him again on the screen, I was happy to see his face. So I want to appreciate Sam Mukasa. I want to appreciate our friends from South Africa, from Sudan, from Nigeria, from Zimbabwe, from Kenya, that have participated in this meeting. Our friends from India, Professor Mani, I want to appreciate you. I can see others from India were in this meeting. Our friends from US were in this meeting. So it has been a wonderful, wonderful meeting. Moving forward, we need to hold follow-up meetings to plan out how we can make up proposals to engage with the ECHO and peace engineering. Thank you very much.
Thank you. Thank you.
Christian, let me just address, let me just specifically what Hans has requested. There are two areas of action that we need. One is how to relate the health and engineering. It's going to be an action, a route that we have to follow. The next one is there are countries already dealing with problems. I can do Nigeria, for instance. We've handled, since this COVID-19, all the deans in Nigeria have been meeting on 5 problems. And some of them have submitted proposals, very clear-cut proposals, how to solve them. I would recommend that 2 weeks from now, let's have a follow-up meeting. One, there is to look at, maybe we'll start from Nigeria. If Kenya has got one, or South Africa has got one, they can also bring up. We just tackle one problem out of the myriad of problems that the engineers have identified. And then we use this as a case to see how we can collaborate. We have issues about these telecoms, which all our students were not able to communicate, do their virtual learning during the lockdown. It's an issue. And we can take one from, maybe start with Nigeria for now, or if there's any other one, we take it, we deal with it, and then use it as a case study. And then from there, we may find that every two weeks, there's a need for a meeting, action meeting. Thank you.
Thank you, Christian. Let me say something. We can divide, like you said, Christian, there's 5, I think you guys identify 5 key areas. So yeah. What we can do is come up with 5 different echoes, one per challenge, or other challenges. Something that we need to address also is COVID testing, PPE equipment, right? Personal protection equipment, medical waste. So there's a lot of, issues that are coming up, but what we can do, you have to drive this. This is the African Deans, identify the challenges, and we will start an ECHO program for you on every channel. We will provide the Zoom connection. You just tell us where do you want to start, and we can start the platform immediately.
Okay, thank you, Ramiro, for that offer. We promise you that we're going to get cracking in the next few days. Within the next 1 or 2 weeks, we'll have another meeting where we are going to develop strategies for engagement.
Perfect. Thank you so much. Again, what we're doing is for Africa and by Africa. So all we want to do is provide that platform and for you to reach out to people like the team we have assembled here. They're ready to work with you. So just let me know how we can help. I want to thank IFEES. I want to thank GDC. I want to thank all the wonderful team that have assembled today. I want to thank the audience, all of you, for participating, for your questions, for your interest. I think it's a go. There's no time to wait. We're ready to move whenever you are. That's my offer. Thank you
very much. We appreciate all our partners from across the world. Thank you for those from Africa. Thank you from all the 5 regions of Africa. We hope that we'll take this process forward. Like we have been saying before this webinar, we have done enough of talking in Africa. It's time for action. And action, we promise, we're going to start. Thank you very much.
The last thing I'm going to say, this is your project. Run with it.
Yes.
Thank you.
Thank you very much.
It's an excellent opportunity. Excellent opportunity, really.
Thank you.
Professor Lormaye is there.
Yes.
Okay, Lormaye.
Professor Lormaye has been with us since. Yes.
No. I think we should think about, can we meet in a week's time? Let's have a quick thoughts. Teresa is there. I can see Teresa. Teresa is there. Claude is there. Claude?
Claude is there, don't find, yes.
Bonjour.
Let's think of a meeting next week. Can we suggest
maybe Monday next week is okay.
Monday next week, yeah. Same time.
Yeah. So Claude
same
is there.
Time Monday.
Is there.
Monday. Yes, Monday can work.
Claude, how are you?
I want to say Monday will be all right about this time on Monday.
Yeah.
Okay, we'll be all right Monday next week, inshallah.
1 o'clock. Is it 1 o'clock?
Same time Monday.
Okay, let's.
That is 2 o'clock Nigerian time.
Same time Monday.
Okay, so you will receive the links.
Okay.
Yeah, and it will come from Ramiro or from our local, since. Basically, you will write a note on this, and then, clear call, we need to identify 5 or 6 areas we want to work on, so that we don't dissipate our energy. Sudan.
And we don't lose the momentum.
Yeah, no, we won't lose it. No. Normally, when we start, we can't lose. So Hassan is there. Tagwa is also there. Ahmed, you're also there.
Yes.
So when we meet, we'll just identify 5 areas. One of them should be how to link up with engineering and medicine.
Exactly, engineering and medicine, yes.
Because if medicine is moving, the governments are sponsoring them to go along with you as well. Ahmed, you are in medicine, aren't you? Ahmed, you are in medicine.
Yes.
No.
Yeah. So you need to think out what to discuss, how to link up engineering and medicine.
I think this is very good to start with this, because you see, when we push this program through medical care, it will be more effective even for the government.
Exactly.
Yes.
Okay. Sam Mukasa is also there. Sam Mukasa is there.
Yes, Sam is there.
Very good, Sam.
So let's see how we can bring in our medical colleges and our medical colleagues on board. And like somebody mentioned in the course of our discussion, let us begin to see how we can think outside the box. Because we all recognize that our governments in Africa, they constitute a problem to the pace of development. So is there any way, is there any approach, is there any methodology or any procedure we can adopt?
That's what we need to.
That can bring in less of government and more of professionals. So let's begin to think along that line. So I think we have started very well, and we will not lose momentum. We'll keep pace. We'll keep energy, and it's a wake-up call for us in Africa to engage with the world